joining us live now from Canberra, Trent Twomey, President of the Pharmacy Guild, for his response. Trent, good to see you. Thanks for your time. So we've got this new report out this morning. Forecasts, 20,818 jobs to go, 665 pharmacies to close. That's pretty specific and is just one report, but how likely, in your view, is that to happen?
Well, it's an independent report. It was done by a renowned economist, Henry Ergas, who worked at the OECD and at Harvard University. It's worse than we thought, Pete. Our internal modelling by the economists at the Guild had it slightly lower than that, but here we have, for the first time, the homework that the government was supposed to have done themselves. So this is the report that should have been done by the Department of Health before a decision was made. But unfortunately, the government was more concerned with an announcement on budget night than they were with consulting. And when you don't consult with frontline healthcare providers, when you don't talk to the people that this is going to affect, these are the unintended consequences that you have. Now, if we have 20,000 pharmacists and pharmacy assistants lose their job, if we're going to have 665 pharmacies close, who's going to be there for Australians before work? Who's going to be there for Australians after they drop the kids to school? Who's going to be there on nights and weekends when no other piece of healthcare infrastructure is open? So we're all for cheaper medicines. We're all for more affordable medicines, but you have to have the pharmacies available, Pete, to give Australians the cheaper medicines in the first place. And that really is the problem.
If that were to happen, what would it mean for services and in particular in rural or regional areas?
So half of those job losses and half of those closures are in regional, rural, remote Australia. So what this will mean is not only do pharmacists have to start cutting back their hours, which is extended hours, so nights, weekends, not just on a Saturday afternoon, but on a Sunday. It means those extra trips to the nursing home. It means those free home deliveries. It means the blood pressure monitoring, the asthma monitoring, all of those things that viewers have come to rely on from accessing from their local community pharmacy are simply gone, because the pharmacies that do survive are going to be stripped back to bare bones and basics. But then there's simply a whole group, hundreds of pharmacies, that won't even be there after this policy is rolled out.
Okay, what do you say to folks who will say, look, this has all been over-egged. The independent report has been done by an economist, and this is all coming from a business angle because it's in your interest to keep patients coming back more and more. I mean, that's right, isn't it?
Well, no. We have been advocating for cheaper medicines, more affordable medicines for over 2 years. So we took to last year's federal election a policy to lower the co-payment, and lowering co-payments and out-of-pocket expenses, how much an Australian, a patient, has to part with at point of care, at point of transaction, is the bit that we should be focusing on. So if we had enough medicine in Australia to give everybody 2 for 1, that would be a great thing to start, but the report already highlights that medicine shortages are a problem. But the issue is here, Pete, is that we had the PM rock up to a bar, announce a free round of beers, get in his Comha and go back to Canberra, and left the publican to foot the bill. So the problem is, mate, is that we need to make sure that the pharmacy can survive so we can give cheaper medicines. And you don't announce a policy that's $4.5 billion, right, with a glossy press release on budget night without consultation. So they need to go back to the drawing board. They need to, as the report suggests, as the opposition and the crossbench are backing in, delay the implementation, not can it, delay the implementation until they can sit down with pharmacists and negotiate how this thing is going to work, how this is going to roll out to ensure that it doesn't adversely affect services that Australians have come to rely on.
So if this presses ahead, if the government presses ahead with this plan, do you expect the prices of medication to increase?
We've already started to see many of the major chains, right, many of the independents, not only start to cut back services in advance of these cuts coming into place, but we've already seen them starting to put their prices up. And they've put their prices up not just on prescription medications, but on medications that you get without a prescription as well, because you're not going to have a small business person, a frontline healthcare provider, sit back and wait to go bankrupt. They're already starting to make cuts to services, and they're already starting to put prices up. And this isn't just the small independent, this is the big chains as well. And that's what the report actually highlighted, Pete. The patient actually doesn't get a benefit because of the reduced services, because of the increased prices in other medications. The patient actually ends up being worse off because of this policy, not better off.
So just finally, how are you pushing back against this? You're putting out a campaign today?
Well, we are, and we're asking the government to simply come back to the table, come back and talk to us, the medication experts, on how we can do both, how we can maintain services and have cheaper medicines. And of course, it's possible, Pete, but it's only possible with consultation, and that's the key point.
Right.
That's the one thing the government hasn't done to date.
Trent Twomey, thanks for your time. We'll talk to you soon.